Kia ora, tēnā koe. Fi Jamieson-Folland, the lifestyle aligner, helping you live the life you love. So it's all about how can regular health screenings be helpful? Lots of H's. So how they can be is we dive into that in terms of the blog. But what I thought I would touch on now are the main health screenings that can be useful based on our risk factors. Our risk factors being what may be there for us in relation to our family history, our lifestyle, our age, etc. And also bearing in mind that the heart disease risk for women is greater than it is for men. So you'll see that it references that quite a lot in the blog this week. The health screenings that I mentioned here that can be useful are, and why is it that they can be useful? Well, if we're more informed about the areas that can go awry, if we have heart disease, they can give us clues. And when we are more informed about where our body's at, that's when we can perhaps adjust our lifestyle, etc., and our approach so that we can create a different outcome that's positive. So blood pressure, hypertension, and this is sometimes known as the silent killer because it can damage our arteries over time. And it's interesting, in a 2023 hypertension journal study, women are likely to develop hypertension, more likely to develop it after menopause. So it can be really useful. Have that reference point 120/80, depending upon our age, and that's something that your primary healthcare practitioner can help you with in relation to your situation. And getting that checked each year makes sense. Blood sugar test. So increased blood sugar, which can indicate pre-diabetes or diabetes, actually damages our blood vessels and it increases our heart disease risk. So it's worthwhile getting a fasting glucose or A1C test every between 1 and 3 years. Next one is an ECG or EKG, which is an electrocardiogram. And what that does is it helps us understand the electrical conductivity in the heart and can indicate where things might be going awry in relation to our heartbeat, the rhythm of our heart. And it can detect kind of the origins of the irregular heartbeat, arrhythmias as they're called. And if you've got family history, if you've had palpitations, it's worth asking for one of those. And being in here, I think, no, it doesn't talk about it here, but being an advocate for your health. So knowing what it is that could be tests that could be useful for you specifically, and including if you have a concern, you might not need to have a family history of, or be in a risk bracket, but you just want to know for yourself. These are things you can ask for. A stress test. So this checks how your heart does under stress, like on a treadmill, usually. And this can be quite handy for spotting areas where the blood flow isn't as good as it could be. And that could be microvascular disease, which can be harder to spot in women. Echocardiogram. So that's an image, an ultrasound image of how the structure of your heart and how it's working. And it can indicate maybe there's a challenge with one of your valves in your heart or more than one. And that, if you're having a bit of shortness of breath or you notice a murmur, that can be a good thing to do. And something that I'm a big fan of, which is a coronary calcium scan. And so rather than just relying on, say, does somebody have high cholesterol, which is quite common, and whether it's the good cholesterol or bad cholesterol as it's referred to, it's more about whether that cholesterol is oxidized or not. And when it's oxidized, it can be laid down in the arteries, and that's where the damage happens, that atherosclerosis. So having a calcium score test can be really good. I found that a game changer. So if you found this useful, or you'd like to dive a little bit deeper, please do check out the blog. And if you're not getting yours, you're missing out. So let me know and we'll make sure you do. Have a goodie. Ciao for now.